Hello everyone, and welcome to the Scarborough Health Network's Community Telephone Town Hall meeting. We are live tonight with Elizabeth Buller, President and CEO of Scarborough Health Network. In addition, we are joined by thousands of residents from across Scarborough listening in. To ask a question live this evening, simply press 3 on your phone's keypad. Once again, press 3 to ask a live question at any time. My name is Eric, and I'll be facilitating the town hall this evening. During this live community telephone town hall, we encourage you to get involved and to ask questions and give your opinion by voting on a few survey questions we have for you. Scarborough Health Networks chose this format as this is an interactive town hall with you, which means they want to hear from you. Liz Buller and Scarborough Health Network's senior and medical leadership team want to share with you how SHN is working to serve Scarborough residents during the COVID-19 pandemic. In addition, we want to hear your feedback and concerns about how Scarborough Health Network can better serve you and your family. Tonight, our intention is to get as many questions from you as possible. You can ask a live question at any time by pressing 3 on your phone's keypad. Someone will take your name and place you in the question queue. Now again, for everyone just joining us, hello and welcome to the Scarborough Health Network's Community Telephone Town Hall meeting. We are live tonight with Liz Buller, President and CEO of Scarborough Health Network. In addition, we are joined by thousands of residents from across Scarborough listening in. We want to remind everyone tonight you can ask a live question at any time by pressing 3 on your phone's keypad. We have a few survey questions this evening. You'll have a chance to vote live on those questions as they come up. Now at this time, I'm going to introduce Scarborough Health Network's President and CEO, Liz Buller, so she can open up the town hall. Welcome, Liz. Tonight is Scarborough Health Network's Community Telephone Town Hall. The purpose of this evening's event is to connect and communicate with the thousands of residents that SHN serves as the province is experiencing an increase in cases of COVID-19. This is an opportunity for you and your team to update and share important information on COVID-19 as we enter the fall season. At the moment, we have quite a few residents joining us, so Liz, please go ahead.
Thank you, Eric, and thank you everyone for joining us this evening for this important community town hall. Scarborough Health Network, or SHN, represents the 3 community hospitals in Scarborough, the Birchmount, Centenary, and General Hospitals. We are over 5,000 staff and 1,000 physicians who are proud to be part of this community. And keeping the health of Scarborough safe and healthy is our number one priority. Over the past few months, many people have been through a lot of challenges, whether it's not being able to see an elderly relative in the long-term care facility, or more recently having to navigate back to school. We are no doubt living in unprecedented and difficult times. I want you to know that Scarborough Health Network and our team of dedicated healthcare leaders are here for you and your families, just as you have been here for us. In March, our Scarborough Health Network Foundation launched a COVID-19 campaign to help our heroes. And when we asked, our generous community stepped up to show their support for our front line. And you raised over $2.7 million. That's helping us to buy life-saving equipment and to support our staff. Over 3,500 individual donors contributed, and more than 500 people wrote wonderful messages of support. Because of your generosity, we were able to deliver over 33,000 meals that kept our staff fed and provided them with the comfort of knowing Scarborough was behind them. We are so fortunate to be part of this amazing community. Today, we would like to discuss how we are preparing for a second wave of COVID-19. We want to hear your feedback and answer your questions. I'm joined today by my colleagues from our senior leadership team and our medical leadership team. On the line, we have Dr. Albert Lowers, who's the EVP Medical, Clinical, and the Interim Chief of Staff, David Graham, EVP and Chief Administrative Officer, Rebecca Harvey, EVP Clinical Programs, Michelle James, the Vice President of People and Transformation, Glenn Boatswain, our Interim Chief Nurse Executive, Dr. Rena Levinsky, our Medical Director for Infection Prevention and Control, Dr. Abdel Belhaj, Medical Director for Infection Prevention and Control. We have Lee Duncan, Executive Director for Communications and Public Affairs, and David Bellis, our Chief Government Relations and Community Engagement. I'm very pleased they're all able to participate this evening and offer their expertise to address some of your questions. Scarborough Health Network has been preparing for a potential second wave of COVID-19 for months. We completed a comprehensive review of Wave 1 to ensure we move forward with the best practices and learning from Wave 1. We have been meeting weekly also with 20 long-term care homes in Scarborough and providing them with the support and education that they may require. We are also currently, most recently, coordinating with our 4 local school boards and Toronto Public Health to quickly identify new infections in our schools and support testing for our children and their families. Here at SHN, we are reviewing our visitors policy so that we continue to keep those in our hospitals safe while providing patients with the emotional and moral support that they need. We are ready for the second wave of COVID because really we actually haven't stopped planning from the first. I can confidently say this because our 2 secret weapons, Dr. Levinsky and Belhaj, who are with us tonight, have been providing their world-class infection prevention knowledge, helping us safely continue our operations. Because of this work and planning, we are catching up on the backlog of diagnostic procedures, interventional procedures, and our elective surgeries. And we're continuing with our roadmap to create our centers of excellence at Scarborough. Many of you may have questions this evening regarding our COVID-19 assessment centers. Some may have seen the long lines and actually waited in them and have concerns about the wait times as a result of increased numbers in people wanting to be tested. Last week, you will have heard the Government of Ontario came out with new guidelines which outline criteria for being tested at hospital assessment centers. And I would encourage everyone who is thinking about getting a test to visit our website at www.shn.ca to find out if you meet the criteria for a test at an assessment center. In response to the increased demand, last week we also extended our hours of operations at the assessment centers, one at Centenary and one at the Birchmount, from hours from 7:30 a.m. to 7:30 p.m., 7 days a week. With that, I'm going to pass it back to Eric so he can open the lines and we can address your questions. Thank you, and we look forward to hearing from you this evening.
Well, we do have our first live question coming up. I do want to remind everyone joining us that if you have a live question you'd like to ask at any time during the town hall, you can do that by pressing 3 on your phone's keypad. Someone will take your name and place you in the question queue. So again, press 3 on your phone's keypad if you have a live question you'd like to ask. We're going to go to Rodney, who is our first live question. Rodney, welcome. Please go ahead. Hi, Rodney. You're joining us live on the line. Please go ahead with your question. Rodney, are you there? All right. We'll try and get Rodney back in just a second. But again, if you have a live question you'd like to ask, press 3 on your phone's keypad, and you'll have a chance to ask a live question. We are going to go to Gladstone. Gladstone, welcome. You're joining us live.
Yes. I would like to know, why is it I have to wait 4 weeks or more to get an MRI? Right now I have sciatica, and they would like to, they prescribe pills for my sciatica, but still no result. And my doctor say she would like to get an MRI, but the waiting is so long. That's one. 2, I would like to get a cortisone injection, and I was told it's going to take me at least 3 weeks to get something like that. Why is it? That's all I want to ask.
Thank you very much for those questions, and my sympathies. I know when you're waiting, it can be quite stressful, and we have had quite a bit of a backlog as we slowed down our ability to do procedures during Wave 1, and we've been working to ramp those back up and meet the needs of the backlog of the diagnostic procedures, such as the MRI, and also getting in for seeing physicians to get injections or other procedures that you might need to improve your health. But I'm going to turn it over to Dr. Lauer, who can give some more specific answers to your questions.
Good evening, Gladstone. Thanks for the opportunity and thanks for asking the question. As you probably know, Scarborough Health Network, like all hospitals in Ontario, were directed by the Chief Medical Officer of Health to reduce our activities. And what happened is it created a really significant backlog of diagnostic imaging studies. As a result of that, people like yourself that suffer with conditions like your sciatica, as you mentioned, had to wait excessive lengths of time. Pleased to say, though, that I understand we're currently ahead of that backlog. We've caught up with it. And in addition to that, we understand recently with the government announcement that there's added funding for diagnostic imaging studies, and we will use that funding to improve accessibility to testing like MRI. So sit tight. I think you're going to hear some good news shortly.
Gladstone, thank you very much for that question. We have another live question coming up, but first we're actually going to do a survey question. So you can actually use your touchtone phone to indicate your response on the following question. We want to know, how often would you like Scarborough Health Network to hold these virtual town halls? If it is once a month, press 1. If it is once a quarter, press 2. If it is less frequently than once every 3 months, press 3. So again, how often would you like Scarborough Health Network to hold these virtual town halls? If it is once a month, press 1. If it is once a quarter, press 2. And if it is less frequently than once every 3 months, press 3. We have another live caller. It's Catherine who's joining us now. Catherine, welcome. Please go ahead.
Hi, I was wondering, my daughter's school got a case was positive today. I was wondering if we are able to still go get tested just to make sure we're not positive.
Thanks for that question. We have Drs. Levinsky and Dr. Belfage on. I think they're best to answer that. Dr. Levinsky, do you want to take that?
Sure. Hi, Catherine. I can only imagine how stressful it is to hear that there's been a case of COVID in your child's school. It would be helpful for me to know if it was a teacher or a student and if your child was sent home. But in general, public health, Toronto Public Health, is doing the strategy across the city in a uniform fashion in how they approach schools. And they will be directing your child's class on whether they need testing. So in general, public health will be recommending testing, even if children are asymptomatic, if they've been sent home and if they think they have a significant exposure, but it depends on the specific situation. And usually, if a child is asymptomatic, then we don't recommend testing until day 5 or day 7 from the exposure, because that's the most likely time they're actually going to test positive for COVID. If your child has symptoms of COVID, obviously that would be a time to get testing. So usually if there's been a significant exposure, your child would be directed to quarantine at home, which is very difficult if they're under the age of 10, and then get testing if they're symptomatic for sure. And then if they're asymptomatic, it would be on the direction of public health. And all children or people in Scarborough who are directed by public health to get testing would be eligible to come to our assessment center for testing. So I'm not sure if you can get back on the line, Catherine, and tell me specifically if it was a teacher or a classmate, and then I could try and answer further.
Unfortunately, Catherine is not on the line at the moment.
So in general, just for everyone on the line, public health will be directing you and your family if they need testing based on what's going on in the individual school. And if you have direction from public health, then you should come to our assessment center for testing, regardless of if you have symptoms or not. If you haven't been directed by public health for testing, even if it's a school child, the direction right now is to wait on direction from public health. And in general, we know for young children, it's hard to keep them quarantined in a room, especially if they're young. So it's really close monitoring of your child for any symptoms of COVID, which, just to remind people, can be cough and fever or shortness of breath, but also can be very atypical symptoms like diarrhea or vomiting or a sore throat or a headache. So if your child in any way seems unwell and not their usual self, and they've had a COVID exposure in school, I would recommend testing.
Catherine, thank you very much for that question. Now, we're still having new people join us. I do want to welcome you to the Scarborough Health Network's Community Telephone Town Hall meeting. We are live tonight with Elizabeth Buller, President and CEO of Scarborough Health Network, taking your questions this evening. If you would like to ask a live question, simply press 3 on your phone's keypad at any time, and someone will take your name and place you in the question queue. We're going to go now to our next live question. It's Maureen who's joining us now. Maureen, welcome.
Thank you. I've been having sniffles for a week now. I'm a senior, and I've had sniffles for a week now. My temperature is 101, and I don't know if I need to go get tested, and I've had diarrhea forever. So I don't have any other symptoms regarding COVID. Can I get some help, please?
Maureen, thank you for your question, and that must be quite worrisome. I'm going to hand your question over to Dr. Belhaj, our infection prevention and control, one of our physicians who are on the line this evening to answer your question.
Thank you, Maureen, for the question. So you have these symptoms that could be due to COVID, could be related to other viruses or other illness. If you are worried about COVID, you can come to the assessment center. It's walk-in, and you can have the test done. But I think if you need a general assessment, you can do it through the family doctor, or if you have a family doctor.
Maureen, thank you very much for that question. We have another live question ready to go. Again, a quick reminder, press 3 on your phone keypad if you'd like to ask a live question. We're going to go now to Rosemary, who's joining us now. Rosemary, welcome.
Thank you. My question is what do we do? What does a parent do whose child has a sniffle, and of course they can't go to daycare? And I'm really talking about children under 2, even under 3. And they've been standing in line, and I know a number of my parents said this has happened to them, in line for 4.5 to 5 hours, which is very hard for a single parent with a child to be in that situation. And they've been to several different centers, and then they have to wait a few days to get the results, 3 to 4 days, which means parent A cannot go to work, or in some of my situations, it's a teacher who's teaching online and then has to keep a child under 2 at home. What is being done to decrease these times, these lineup times, and how are we able to support a parent with a young child? I mean, this is it's just unacceptable to have a young parent with a young child to be standing in line for 5 hours. Ended up with one of my parents, it was just a sniffle and a cold, but they still had to wait. It was not COVID at all.
Thanks for your question, Rosemary. I know we're all finding this very challenging and trying to find the best ways and the right answers. And I'm going to turn it over to Drs. Levinsky and Belhaj to answer this, as they're helping us navigate this at Scarborough Health Network the very best way possible for the parents and young children to start. And then they may hand it over to Dr. Lowers and Glenn. But can I have Drs. Levinsky and Belhaj start with your thoughts and what's happening, what we're trying to do in these situations?
Sure. So I think it is very distressing to have a young child who's sick, especially in the era of COVID, and it's infuriating to have to wait in line with an older parent or a young child, especially as the weather is getting colder. And this is not something we want to have happen to our community, but unfortunately, there is COVID in the community on the rise, and we want to encourage people to get testing when they have symptoms, just as you were trying to do for your young child, because it's important to know for your child's health, but also for yourself if you've been exposed to COVID. So I think it is important to go for testing if you or your family have symptoms. I think it's difficult for the elderly and for young children to wait in line, and frankly for everybody. And what we're doing at the Scarborough Health Network is actually ramping up to open up a 3rd assessment center at the General. And I can possibly have Glid Botswain, who's leading our assessment center program, speak to this. But our goal is to try and have protected time for children and ideally increase our capacity with a 3rd assessment center so the lineups will be shorter. And with the new guidance document, I'm not sure if people are aware, but since last Friday, the government has really decided that the assessment centers should be for people with symptoms. This will capture the people with COVID disease who are most likely to have COVID disease, but also shorten the wait times at the assessment centers and also shorten the number of tests going to the lab so that the test results are faster. So already today, Dr. Bert Lowers was on the phone with our lab advocating for faster turnaround times for results, which has been an issue for you and your family. And already the hospital, in preparation for the second wave and seeing our lineup increase daily, is working on increasing capacity and building a new assessment center.
Rosemary, thank you very much for that question. We have our next live question coming up now from Eileen. Eileen, welcome. You're joining us now, live. Please go ahead. Hi, Eileen. You're joining us live. Please go ahead with your question. Yep. Are you there? Please go ahead. All right. We'll try and get Eileen back in just a moment. We do have another live question ready to go. Again, a reminder to everyone joining us that if you have a live question, you can press 3 on your phone's keypad, and someone will take your name and place you in the question queue. We're going to go to Mary. Mary, welcome. Please go ahead.
Oh, hi. I guess that's me. I left a question earlier.
Yep, please go ahead, Mary. You're live on the line now.
Okay, yeah. It was in regard to the going to emerge if I had to, what the protocol is, and about the second wave. It sounds like it's different, and I know the hospitals are more prepared and they're well in the first, and I just wondered what the protocol was if you had to go to emerge.
Thanks a lot, Mary. If you need emergency services, we really encourage everyone. If you feel unwell and you need to go to the emergencies, please do. Our emergencies are safe places to go, and they're running as we always have, as usual. But I will hand it over to Dr. Lowers to speak to specific protocols or anything in particular unique to the emergency department.
Thanks so much for that, Liz, and thanks, Mary, for the question. Never a comforting thing to go to the emergency department. It's always a place where people are concerned. That's why they come, and we think we have a great history of timely service in our emergency departments at all three sites. When you come to the emergency department, you will be seen by a nurse who will triage you according to your symptoms and make an inquiry, and you'll be seen usually promptly by a physician, depending on the nature of the concern that you have. The other question that you have is about the second wave and what our understanding about it. It's been very challenging in terms of modeling and understanding what the second wave would bring us. I can tell you the Scarborough Health Network has been busy for many months, many days. And in fact, we have a series of work streams which are designed to assist with understanding how patients will come to the hospital, how they will be seen, how they will be held, and how they will be admitted, whether that be discharged back home with instruction, referred back to their family physicians, admitted to our hospital, admitted to our intensive care units. Lots of information is ongoing, and review is ongoing to make sure that trip is as pleasant as it possibly can be, as trying as it is at the time. But if you're suffering with a medical condition and you feel you need to be in our hospital, you're very welcome.
Thank you very much for that question. We have another live question coming up now from Geraldine. Geraldine, welcome. Please go ahead.
She actually stepped away. Could you actually, she's coming right back. Could you ask her in a few other questions?
Sure. We'll see if we can get back to her in just a moment. But in the meanwhile, we do have another live question coming up, and it's going to be from Jackson. Jackson, welcome. You're live on the line. Please go ahead.
Thank you. Good evening. Thank you for taking my call. I wanted to, the old adage before COVID and even now, the old adage was if you want to get sick, go to a hospital. And especially when COVID began, I know that I've had appointments with specialists that I've canceled because I didn't want to go to the hospital. Now, is there any way that you can alleviate people's concerns about this, about going to the hospital?
Sure. Thanks for that question, Jackson. I think that always lingers out there, especially with so much information and our constant sort of new information that we have on a daily basis. I would, as CEO for the hospitals, say, please, our hospitals are safe places to go if you need to be there. So I'm going to ask again Dr. Levinsky and Belhouse to speak to those from their lens as infection prevention and control specialists and infectious disease physicians. Can I turn it over to you?
Yes, thank you. Thank you, Liz. So thanks, Jackson, for the question. So again, if you are sick and you need to come to the hospital, you are welcome. I just want you to know that our hospital is safe, our emergency is safe, and during the first wave, we did not have any outbreak in the emergency. We did not have any transmission of the virus to the medical staff or to other patients who are in emergency. And we implemented strict infection control measures to protect patients and to protect staff. So the hospital and emergency is very safe. If you need a medical appointment or emergency, you are welcome to come, and it's very safe.
Thanks,
Dr. Lauer speaking. Perhaps I could add to that if I could. One of the things we've also done, Jackson, is to add this component of virtual visits. Basically, your physician can meet with you online, and you can have an information exchange that way, and many people have adopted that if you're not comfortable coming to the hospital. But further to what Dr. Belhouse said, I'm going to actually quote Dr. Levinsky, who's also on the phone, and the one thing that she has told us about COVID is a community-transmitted infection. It's actually not in the hospitals. We do have patients with COVID, but we're very good at controlling it and understanding what it is. And with the expertise of Dr. Levinsky and Dr. Belhouse, we keep our people safe and we keep our patients safe.
Thank you very much for that question. We're going to go directly to another live question. This one is coming up from Anwar. Anwar, welcome. Please go ahead.
Hi, good evening. My question is maybe the doctor from the infectious doctor can answer to me, because since I'm not a doctor, what does the second wave mean? Because as a layman, I don't understand it. The virus has changed, or the virus, if he can explain to me what second wave mean in regard to the virus. And the other one is now masks are mandatory, and so why are the cases rising if masks are useful, and why does it took long to make them mandatory? Because COVID is almost a year, and the masks become mandatory only in the last couple months. Thank you.
Thank you very much, Anwar, for those two questions. Your first one, I'm going to turn over to Dr. Levinsky, and actually she can probably jump in on your mask question too. Very important question.
Sure. Thanks, Anwar, for those questions. So the second wave is just a metaphor. It's just an image to picture what's happening with COVID. Just like the ocean has waves that come in peaks, so the waves go up, we're seeing cases rise again. So the second wave just refers to a rise in cases that we're seeing in Ontario and in Toronto. And you obviously are aware of that because you're wondering, why are the cases going up? So masks are definitely an important strategy. If you're going to be less than 6 feet away from someone, you should be wearing a mask. This helps contain your cough or your symptoms of COVID, even if they're very mild, and it helps protect others because you're wearing a mask. And it also protects you from other people, so if they have COVID, it can be transmitted by little droplets from them coughing or speaking or singing, and you are protected by wearing your mask. So why are the numbers going up? It's because everybody's not being as careful as maybe you are being careful. So people are starting to gather in larger numbers. The weather was nice in the summer. people have let their guard down, and they're spending more time in close quarters with other people. And on average, someone with COVID infects 2 other people. So the more people that gather together, the more people are exposed, the more people that are getting sick. So this second wave, this increase in cases, is because of people not wearing masks, people hanging out in large gatherings, and people actually having symptoms and not staying home. So the way to stay healthy is to be washing your hands, wearing your mask when you go outside, and limiting the number of people you have contact with.
Thank you very much, Anwar, for that question. We're going to go to another live question. This one is coming up from Ross. Ross, welcome. You're joining us live. Please go ahead.
Yes, thank you for my call. I have a question. We have 3 hospitals in Scarborough. All 3 were affected by COVID. My question is, why not make one hospital COVID central and the other 2 hospitals carry on with normal procedures? It seems to me a bit ridiculous to close all 3 hospitals to COVID when with the 3 we should be able to manage things better. Thank you.
Thank you very much for that question. And it is certainly something that's been a consideration, in particular in the first wave, as we were anticipating significant numbers, and would be something we continue to evaluate as we go into wave 2. Not being the expert on those numbers, though, we're using up a lot of our energy here with Dr. Levinsky's and Belhaj, but they're our experts. So I'm going to ask maybe Rena, Dr. Levinsky, and Dr. Belhaj if you can address that question and how we're looking across our 3 sites so we can ensure we're providing care across Scarborough.
So sure, Ross, I'll be happy to take that first. The question you have asked has actually been asked across the hospitals during the first wave. The issue with needing all 3 hospitals to take care of COVID patients is because COVID patients will present to all 3 hospitals, and COVID patients will need our critical care units. So each hospital has a place for very, very sick patients where they can be put on life support, and we need access for anybody who presents at at any of our 3 hospitals to have critical care beds. And unfortunately, COVID symptoms can be very subtle. So it's almost impossible to only have COVID patients at 2 sites because people will present with subtle symptoms that we may think is one diagnosis, but they actually have COVID or they have 2 problems going on. That's what we found in the first wave, is that patients presented with one issue, but they also had COVID. So unfortunately, with the numbers rising in Toronto, it may be impossible to keep 2 hospitals or 1 hospital COVID-free because people have more than one problem, and the community of Scarborough needs to have access to critical care if they get very, very sick. And we need to use all our critical care beds at all 3 sites for people with COVID. So in an ideal world, we'd have a COVID-free hospital. I'm not sure that's actually feasible in real life. But what we try and do is limit our COVID patients to certain parts of the hospital and use our critical care beds for COVID patients when they need them. So we're providing the best care to our patients, but also keeping as much of the hospital open for other patients who have other needs.
Ross, thank you very much for that question. We have another question. It's Geraldine who's joining us live now. Geraldine, welcome. Please go ahead with your question. Hi, Geraldine. You're joining us live. Please go ahead. Geraldine, are you there? All right, we'll try and get Geraldine back again in a moment. But in the meanwhile, we have a live question from Hansa. Hansa, welcome. You're joining us live. Please go ahead.
Good evening. Thank you for holding this town hall and giving the community a way to get information on what's happening with the COVID situation. My question is regarding the Ontario Breast Screening Program. I was wondering if that program is still active or is it on hold on account of the COVID situation?
Thank you very much for that question, Hansa. I'm going to turn that over to Rebecca Harvey. Actually, sorry, Dr. Lowers, to answer that question.
Thanks for that question, Hansa. The diagnostic imaging area of our hospital is one of the areas in which we had a significant backlog but the team has been working hard at catching up with the backlog. The Ontario Breast Screening Program is back and functioning at this time, and so you're more than welcome to return to the hospital.
Hansa, thank you very much for that question. Up next, we have Terry joining us. Terry, welcome. Please go ahead.
Thank you very much. My primary care physician is part of the community care system, and I understand why I haven't been able to have any hands-on type medicine during the COVID situation. But she's also not capable of doing any kind of video contact with me. And I was wondering if it would be within the purview of the Scarborough Health Network to ensure that all of their physicians have access to video contact with their patients.
Thanks so much for that question, Terry. And we have seen the opportunity and the actually demand for virtual care rise exponentially during the COVID wave one, and there's been some really great uptake and some huge benefits. I'm going to ask Dr. Lowers to speak to this, as he oversees our partnership, and also he could speak to our Ontario Health Team work as well. But how we're doing that both within the Scarborough Health Network in partnership with primary care and then our Ontario Health Team. Can I hand that over to you, Bert?
You can. Thank you, Liz, and thank you, Terry, for the question. So Scarborough Health Network, frankly, was initially slow at adopting virtual technology. So we had a partnership with Ontario Telenetwork over the last 18 months to try to improve our uptake with virtual technologies. So prior to April of this year, we were doing about 200 visits a month. After April, though, we went to 4,000 visits a month. There's a tremendous amount of uptake with our physicians using virtual technologies, and frankly, we feel we've hit the tipping point where this is here to stay, and it's never going to go away, and we think it's a great opportunity. It doesn't mean that people don't need hands-on medicine. They certainly do from time to time, but the virtual is a way to go, and I don't believe it'll ever leave the healthcare sphere. In addition to that, though, we actually are linking with primary care physicians in the community. We have an Ontario Health Team. The Ontario Health Team is a multitude of healthcare partners brought together to try to look after the entire population of Scarborough, all 632,000 people. And we're linking primary care more with the Scarborough Health Network with a major outreach. There's been the formation of something called the Scarborough Family Physicians Network, and that network is reaching out to the 32 different groups of physicians, primary care physicians in the community to try to improve linkages and familiarize them with what our products are, and also to allow them to better be able to care for you and other patients. So we think this is a prime opportunity, and we're open for business in terms of linking with primary care to help the very types of visits that you're referencing, virtual visits.
Terry, thank you very much for that question. We're going to go to another live question from Sybil. Sybil, welcome to the Town Hall. You're joining us live.
Thank you. My question is, I'd like to get some answers. I know someone who had COVID. She went into quarantine and they said she's okay now. Can I associate? Is it safe to associate with that person?
Thank you for your question, Sybil. I know there's a lot of confusion out there about what we can and can't do. So I will turn it over again to Drs. Levinsky and Belhaj to answer that question.
Thank you, Sybil, for the question. So every patient who's tested for COVID come back positive, it's always followed up with the Toronto Public Health. And the Toronto Public Health, they will let them know for the period of self-quarantine or self-isolation. Generally, right now it's for 2 weeks from development of the symptoms. And after 2 weeks, those persons, if they are in the community, they are not contagious, and you can socialize with them. But remember, it's 2 weeks but the public health will clear them to be out of the isolation or quarantine.
And if I'm right, Dr. Belhaj, still social distancing and wearing a mask.
Yes.
Great, thank you. Back
Sybil,
to you,
thank you. Yeah, Sybil, thank you again for that question. We're going to go directly to Gloria, who has a live question. Gloria, welcome. Please go ahead.
Thank you very much for taking my question. I have a friend who is working with the long-term care, and she tested positive for COVID. She went for quarantine for 2 weeks, and then she told me that she's going back to work without having the follow-up test. They told her that she does not need a follow-up test. Is this true? Thank you.
Thanks, Gloria, for that question. Again, we know there's a lot of information out there, and it's hard to synthesize it all. I will turn that over to Dr. Levinsky.
Hi, Gloria. Thanks so much for that question. So we have learned a lot about COVID since we first heard about it in China in January. And at the beginning, you are correct. We used testing to make sure that people weren't contagious. But now they've done studies that on average, a person who has COVID is really only contagious for 7 days. And once their fever goes away and they don't need oxygen, they're not contagious. As an extra precaution, Toronto Public Health is keeping people isolated for 14 days. So this is even longer, that's likely necessary, but as an extra precaution to make sure that people are not contagious before they go back to work or see their friends or their family. So this guidance just changed a few months ago, but initially you are right. We were testing people to see if they cleared COVID. The problem is that people with COVID can have positive tests for a very long time because they're actually shedding dead virus. And then when we were isolating people waiting for their tests to clear, we were actually just keeping people isolated for weeks or sometimes months unnecessarily. So the guidance has now changed, and your friend was following correct public health measures that once the 2 weeks is up from symptom onset, they are safe to go back into the community and to go back to work. And this is the same process we're following in the hospital as well. It's all over Toronto and Ontario.
Gloria, thank you again for that question. We're going to go now to Christina for a question. Christina, welcome. Please go ahead.
Hello. Thank you for taking my call. I'm just concerned about learning that essential caregivers will be allowed into long-term care facilities to help out with their, immediate patients or relatives. And they are also allowed to help. They will also be allowed to help out with other residents in the long-term care home. This alarms me because these caregivers are coming in from the community, and I don't know what kind of tests they will have before entering these premises, and how will the long-term care homes be able to monitor all this?
Thanks, Christina. That's a really important question, and I know that was new information today through the ministry, and lots of guidelines being worked through. I'm not sure we'll have all the answers to clearly address your question, but again, I'll turn it back to Dr. Belhaj and Levinsky to address that question.
Personally, I don't have the answers to this question. It's just announced today, and I'm not aware of any details. I don't know, Rina, if you have any more information.
So I'm sorry, Christina, I don't have more information. But what I do understand is your concern about long-term care homes. We, as part of Scarborough, saw the devastation, the amount of COVID infections in our long-term care facilities, and how it spread so quickly in long-term care. And your question really goes to your fear that caregivers are going to bring COVID back into long-term care. So the Scarborough Health Network is actually partnering with our long-term care partners to help prevent COVID from entering the homes during the second wave, to help protect our families and our loved ones and people living in long-term care. So in general, in long-term care, everyone who goes into the home is asked questions, staff and visitors, of whether they have symptoms for COVID. And until today, if someone was going to have a visit in the home, they were required to have a test to show that they were negative for COVID within 2 weeks of coming in. So I haven't read the new guidance document from today, but the assumption will be that anyone going into the home will not have symptoms of COVID, will be wearing a mask, and I would hope only be involved in their loved one's care, but I don't have the document. So maybe we can answer that at the next town hall, but please be assured that Scarborough Health Network is working with long-term care, and we will be working with our community partners to prevent COVID from entering long-term care facilities. And that is the same goal long-term care has. They don't want to bring COVID into the homes too. They want to protect their workers and their residents.
Christina, thank you very much for that question. We're going to go to another live question from Chris. Chris, welcome. You're joining us live. Please go ahead.
Hi, thank you for taking my question. My first question is specifically about outpatients in the oncology. And currently they cannot have anyone accompany them to their appointments for MRI, CAT scans, blood work, doctor appointments, although some of them are being done over the phone now. And I'm just wondering what the future looks like for accompanying a loved one to these critical appointments. I understand, obviously trying to limit the exposure to COVID, but on the compassionate side, there's other things to consider. So just wondering what the future looks like for that outcome.
Thanks so much, Chris, for that question. A really important one, and one we do struggle with in trying to have the balance of keeping the organization safe and yet making sure we try to meet the emotional and psychological health needs of all of our patients and families as well. I'm going to ask Glenn Boatswain, our Chief Nurse Executive, to start with that, and then others may jump in. Glenn, can I ask you to start with how we're managing visitation and accompaniment of guests for our patients?
Thank you, Liz, and thank you, Christine. Like Liz said, very important question. And we are trying to balance, as compassionate care, and trying to keep everyone safe. We are reviewing on a daily basis our visitor policy just to ensure that, we're making it more inclusive. And especially for the group of patients that you've mentioned, we do with the managers along with the physicians. They work on an individual basis to ensure, if it's required, that we look at it and we're able to facilitate. But we take each case by case right now, but we're reviewing every day, and we'll continue to expand as much as possible, but doing it in a safe manner, Christine. Thank you.
Chris, thank you for that question. We have another live question coming up now from Martha. Martha, welcome. You're joining us live. Please go ahead.
Yes, I did start with my question. It was about the seniors building. If they couldn't arrange to have testing done in the seniors building, because some of us, it's hard for us to get anywhere. In August, I managed to get a ride, and I went to the testing center at Centenary Hospital because I was concerned. But I can't always get a ride. And now I find I'm coughing. I have bronchial asthma, so I'm coughing and runny nose, and it concerns me. And I can't always go to these testing places to line up to get tested. Is there any way that the government could set up a testing even now and then in the building to see what's going on?
Martha, thanks so much for that question, and we've really been trying to address that as best we can because we know how challenging it can be, just travel, getting around, waiting in lineups, and Dr. Bert Lowers has been leading, working with our long-term care homes, our congregate care homes, and other facilities, so I'm going to maybe ask him to address that the best way. Bert, can I turn it over to you?
Yes, thanks so much for that question, Martha. So a compelling and important question. We do have a number of frail seniors living in homes in Scarborough, and we look at all of that as our population whom we care for. We actually, Glenn, who's also on this, Glenn Boatswain, our Chief our interim chief nursing executive, is also on this call, and she is actually the individual who has been leading teams of nurses to go into long-term care homes, retirement homes, congregate care settings, settings where seniors are vulnerable and are assisted and have assistance in their care as well. So those teams do mobilize, and we do this not infrequently over the last few months. One other area is home and community care. If you have that kind of support involved with you now, you can do an outreach to home and community care. My understanding is they will send a nurse in to do swabbing for COVID in the home, but it's something you'll have to ask for specifically. But we do mobilize when necessary, and we also mobilize particularly to vulnerable seniors' residences.
Martha, thank you very much for that question. We're going to go directly to Bina for another live question. Bina, welcome. Please go ahead.
Yeah, first of all, thank you very much for this wonderful program. My question is, can seniors go for their own grocery shopping if there is no other choice, and what precautions they should be taking?
Thanks for that question, Bina. Again, there's so much out there that it's hard to keep track of what's safe and what's safe not to do. I'm going to ask Dr. Levinsky to address that question for you.
Hi, thanks so much for that question. I think it's very stressful when you hear so much news about COVID and COVID cases rising in Toronto to know what's safe to do and what's not safe to do. And definitely you need groceries, then you're going to need to be able to go grocery shopping safely. So I can speak to how to do that safely. If you have families who can drop off groceries, if you're able to order groceries online for delivery, that might ease your anxiety. But going to the grocery store can be done safely. The key is to make sure you're wearing a mask when you go to the grocery store, that you clean your hands before you go into the grocery store, ideally with an alcohol hand sanitizer, something like Purell, but any no-name brand. Alcohol is actually the best thing to use to clean your hands to protect yourself from COVID. It is better than soap and water, and actually you can carry it in your car or if you're taking public transportation. And then once you finish grocery shopping, you would want to make sure that you also clean your hands with alcohol hand sanitizer. So it's really making sure that your mouth is covered and your nose is covered when you're grocery shopping, cleaning your hands before and after, and trying to stay 6 feet away from people. So if you're distanced, even if they have COVID, if you're wearing a mask, you're decreasing that risk of getting sick because you're wearing a mask and you're staying 6 feet away. And we know when people have COVID, they're only contagious within 6 feet, so being close to them. So it's best to try and find a grocery store that's close by, so you don't have to take public transportation, that ideally you can walk to or drive to, and that when you're there, you're trying to stay away from people. And some grocery stores have senior hours or are less busy first thing in the morning, so going earlier in the day may allow you to be more comfortable because you're going to be around less people.
Bina, thank you very much for that question. We have another live question coming up now from Winnie. Winnie, welcome. You're joining us live.
Okay, thank you for taking my question. My question today is, with the flu season coming upon us, how will we know if we have the flu or if we have COVID-19?
Thanks so much for that question, Winnie. And again, I'm not sure we can give you the exact answer, and I'm going to turn it back to, maybe I'll ask Dr. Belhaj to take the start on that, and Dr. Levinsky.
Thank you. Thank you, Winnie, for the question. Yes, there is overlap of symptoms between COVID and flu. What we learned from the winter in the southern hemisphere, that because of the precautions that we did for the COVID, they had very small, very small activity of a flu. So the first thing what I would suggest for you to get the flu vaccine. So because the flu can be as bad as the COVID, and if you get the vaccine, you will protect yourself from the vaccine. If you develop symptoms that you are not sure if it's COVID or flu, you can come for testing, and they can test for COVID. And I don't believe the assessment center will test for the flu, but they only test for the COVID. But the most important thing, I would suggest for you to take the flu shot and to follow the social distancing, wearing a mask outside, and I'm sure this will minimize the risk of getting any respiratory infection.
And then I'm just going to add to that, Winnie. Thank you for that question. I completely agree with Dr. Belhaj. Everyone who's on this line should be encouraged to get vaccinated for the flu. Protecting yourself against one infection is just one less thing to worry about, and the symptoms definitely overlap. So in an ideal world, you would go to the assessment center if you had flu-like symptoms, which would be fever, sore throat, cough, shortness of breath, muscle aches, and you'd get tested for both COVID and the flu because they both can present with those symptoms. Unfortunately, we're trying to preserve testing in our labs for COVID testing. So we are only testing outpatients for COVID. If your COVID test is negative and you have flu-like symptoms, you should stay home for 5 days after your symptoms started, because if you have the flu, you're contagious for 5 days. If with either infection you're short of breath or feeling sick enough that you need to seek medical attention, of course you should come to our emergency room. But the two diseases overlap. And if you're an inpatient, only inpatients, unfortunately, will be able to have testing for influenza and COVID at the same time. But in general, even before COVID, outpatients were not tested for the flu. Because it doesn't really change people's management, it's mostly just to stay home and symptom management as opposed to needing hospitalization unless you're feeling that you're short of breath and need oxygen. So for now, what I would say is get your vaccine, and that if you're sick, the key is to stay home until you're feeling better, no matter what the infection is.
Thank you very much for that question. We have another live question from Lillian. Lillian, welcome. Please go ahead.
Yes, hello. Thank you again for this. This is wonderful, very informative. Now, I'd like to explain something and then ask my question. As a senior, my husband was in Birchmount Hospital, and of course I didn't see him for the 3 weeks he was in there. We had a follow-up appointment last week, so I thought I would get online and reserve. My daughter taught me how. I am a senior, taught me how, and reserve an appointment to go and have another COVID test while I was taking him for his appointment at Birchmount. When we arrived there, not only could I not get my COVID test because there had to have been, and I'm not exaggerating, over 100 people in line, but I could not even find a parking spot and had to ask someone if I could park in a handicapped spot to take my husband in the hospital. So my question is this: what is the purpose of us as seniors trying to make an appointment online to have a COVID test and then going there? Do we not get a time or anything like that to go and have your test? Or do you still have to stand in that line of 100 people? Now, I understand, I listened to what Martha said, and she covered a lot of it about the seniors' homes. However, we are in our own home, so we don't get that service. But if you make an appointment, how come we're not given a time to be there to take the test?
Thank you so much for that question, Lillian. And again, we know that the lineups have been increasing and the time waiting and the frustration that you're experiencing. We're really trying to address that and apologize for that frustration. I'm going to ask Glenn, our Chief Nurse Executive, to take a first kick at the answer to that and a response of where we're at and what we're doing. And then maybe Dr. Lowers would like to jump in as well.
Thank you, Lois, and thank you. That's a very good question, and I can definitely understand your frustration because what you're doing online is called a pre-registration. And right now we're not giving appointments because here at Scarborough Health Network, unlike some other hospitals who have by appointment and you may have to wait a week or so for an appointment, here you come and get tested right away. But when you arrive and you see such a long lineup, it can be very frustrating. But we are looking at it, like Dr. Lewinsky said earlier, we're looking at children and the elderly, how we can fast track that. and opening the general site, we were looking maybe where we have appointments there. But we're very much aware of it, and we are addressing it. We do ask for your patience at this time, but with a high volume of patients, we're trying. The team is trying their very best, but we're always reassessing, and hearing from you just reinforces that we need to address the issue. So thank you so very much.
Lillian, thank you very much for that question. Now, Liz, we're actually just about Liz, we're actually just about reaching the end of the town hall. With the last couple minutes remaining, did you want to share some closing remarks with everyone listening?
Sure. Well, I just want to thank everyone. We've actually had an hour online. It's been great for us, and we really appreciate everyone joining us this evening. I thank the community for signing in and bringing forward questions, concerns, and issues. It's hugely important to us, and I thank the senior leadership team and our medical leaders who were on the call tonight. And as you can see, I hope all of you who were here this evening saw how important it is for the community to hear from you, and really appreciate that. It's being very, very informative. We will be posting a live recording and answers to the questions. For those that are online and want to share it with friends or family, it'll be posted on our website at www.shn.ca. And if you have questions that we didn't get to, because we know many more people sign up, then we can answer all the questions depending on how complex they are. We really, it's important for us to get back to you. So please feel free to email us at communications@shn.ca. and we will get back to you with a response. And so, again, I thank you. I ask you to stay safe, practice social distancing, wear a mask, wash your hands. I know it's a challenging time, especially with Thanksgiving around the corner, and it's been a long journey, but we will get there, and we appreciate your persistence and your support. So have a great evening, and thank you again for your time.
Thank you again to everyone for joining us this evening. If you have any questions or feedback that you would like to share with Liz and the Scarborough Health Network leadership team, you can do so by emailing communications@shn.ca. Just a reminder, you can email your questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications@shn.ca. Thank you again to everyone for joining us, and have a good night. Questions and feedback to us at communications